Hey guys, me is Dr. M, your doctor of St. Charles. And see this guy back here? He's actually suffering with what's called sciatica. And what that is simply the largest nerve in your body. And that actually goes down on the leg and give you numbness, tingling, back pain, leg pain, and so forth. But a lot of times, a lot of people are getting treatment for sciatic pain, and they're getting the wrong type of treatment. In fact, a lot of people out there that are actually suffering with sciatica, what they're doing is actually they're just working on their muscles. And so a lot of people out here that are in St. Charles, Batavia, South Elgin, West Chicago, and so forth, Geneva, what I've noticed is that a lot of people are just doing foam rollers as well as just, balls that are golf balls that are trying to rub the area. And that's good because it can help relieve some of your pain if it's a muscle problem. But unfortunately, even if it's a muscle problem, when you do have muscle imbalances and problems, getting rid of the symptoms is not always the best thing to do. And I'll tell you why, is because typically when you're working out and you're symmetrical, and especially when you're dealing with sciatica, the body, the muscles should be tightening up together if you're symmetrical. But if one part of the body is spasming, like in piriformis syndrome, when it's putting pressure on that sciatic nerve, and all of a sudden there you go, you start rubbing and massaging that out, you'll start feeling better. But unfortunately, the underlying cause of that problem will continue to keep getting worse. And so over a period of years, that problem that you once were dealing with sciatica can eventually lead to herniated disc, it can lead to bulging disc, degeneration, arthritis, spondylosis, and just a whole bunch of things, guys, that you don't want to mess with. And so what I would suggest to you, there are a lot of people that have sciatic type of pain. And just because something worked for somebody doesn't mean they got through the root cause of the problem, because there's many causes of sciatic type of pain as well, too. We want to look at the underlying cause. And so if you live out here in St. Charles or Batavia, Geneva, Elgin, or surrounding areas, here's what I want to do for you. First of all, I want you to know what the cause of that problem is. And so some cases people have a mild scoliosis. Sometimes people have a larger scoliosis that puts the spine basically over here out of alignment. Once that spine is out of alignment, what happens is next, that pelvic bone, it will rotate and derotate and spin, if you will. And that'll put pressure on that nerve, and then that piriformis muscle will tighten and spasm, and then we start getting the numbness and the tingling and the leg pain. We don't feel very well. And so what we want to do in this office here in St. Charles, what we want to do is we want to find out what the cause of your problem is. Because we know not if we can get rid of your symptom, but if we actually get rid of your cause of your problem, then you're lessening your chances of developing risk factors in the future of disc degeneration, herniation, bulging, and arthritis, guys. And so really, what I want to do for you is something really special. Out here in St. Charles, here's what I'll do. I'll be straightforward and honest with you. If I can help you, I will. If I can, I'll try to give you the best recommendations for you. But what we'll do is we'll give you a free consultation for about 10 minutes. The reason why, because after about 10 minutes when I listen to your history and I've got a good idea of what's going on, I can pretty much tell you, of practicing over 20-some years, what's going on with you and what the best procedures, what the next thing you should be doing to take care of that sciatic pain that you're dealing with. And so if that's something that you're dealing with right now, guys, you are literally a phone call away. All you have to do is simply give us a call at 630-443-4411. Again, that's 630-443-4411. We're a Lighthouse Medical Group in St. Charles. Again, we are in Lighthouse Medical Group in St. Charles, and I'm Dr. M, and I want to see if I can help you. But guys, don't take that lightly, because that nerve, I want to show you something. That nerve that comes into your lower part of your back, it not only just causes leg pain and back pain and other symptoms, but those delicate nerves also go to other organs inside your body. So a lot of times when people are having issues with sciatic pain, what we find out, especially when they're in that acute stage, they'll have issues with their gut. They'll start having issues with, they're not moving their bowels the way they should be. And so that's something, your gut is 80% of your immune system sits inside your gut. So we don't want those things to get bad. We want you to make sure that you're not only out of pain, but you're actually healthy for the long run. Okay, so if that's something that's interesting to you, you got nothing to lose. We're going to give you a free consult. All you got to do is give us a call at 630-443-4411. I'm Dr. M. You guys have a wonderful day. Take care.